I'm Suzanne. I'm the founder and CEO of HidraWear and Solutions. We make wound care products specifically designed for people with HS. And I'm here with Dr. Ghias, who I adore. We're both on a mission to improve the lives of people with HS. Do you want to introduce yourself?
Sure. So I'm Dr. Ghias. I'm a dermatologist and I specialize in HS. And I'm also the co-founder and chief medical officer of Tono Health.
And what is Tono Health?
So Tono Health is a digital dermatology platform that is really focused on increasing access to expert dermatology care for conditions like HS.
Amazing. So we'll start with just a discussion around, I suppose, HS management, treatment, wound care, which is sometimes overlooked, and then how HidraWear and Tono Health have come together to make it really easy and quick to access care, treatment, and wound care supplies. We can start off just talking about flare-ups, because we know that a flare-up can happen anytime. They're unpredictable. They last for days or weeks or months. They can surprise you. So sometimes, typically, when you need to get an appointment, you might not be seen. So do you want to talk about that a little bit in the context of traditional dermatology and what Tono Health offers?
Yeah, absolutely. So, I think that so much of the patient experience is really based on struggling to get access to a dermatologist, and even greater, to be seen by an HS specialist, because they're few and far between, and the wait times can range, anywhere from 1 month to 6 months. And chances are that by the time you're at the appointment, you may not have a flare. That doesn't mean that, your day-to-day experiences aren't valid or aren't, something that you're experiencing. It's just, how do we capture and communicate that information to the providers? And so that's really what we're at Tono is making sure that we have a framework set up that patients are able to share that information with us, with their provider, and to really, be able to track their progress over time.
Yeah, and something I learned recently is that so a patient can upload their photos to the Tono Health platform, and like you just said, keep track of the progress that's been made, but they can also track the medications that they're on, the maybe lifestyle changes that they've made, their pain, and they can track every part and leave little notes to kind of see the progress that's been made, or maybe something that might have happened that made the HS flare up as well. So they're able to track their progress and symptoms, I suppose, as well. So it's a really very exciting thing for me to hear, because that's something that I've done over the years is in a diary, I had this today, I had a tough week this week, or, and you're kind of trying to figure it out. So it kind of just makes it a lot easier for patients to actually have a sense of control over their disease.
Exactly. And, we even added, based on patient feedback, a journaling feature and, the symptom tracker, because a lot of patients were saying, I also want to be monitoring my progress in response to various treatments, or, in terms of how much drainage am I having, based on other things that may be going on with their life, and having the option to share that with their provider. So, everything is secure on their end. There are some patients that are like, I want to maybe have my provider be aware of this flare and what was going on and how it may, impact our, treatment plan moving forward.
The reason I think that is so special is because by the time normally you get to see your doctor, if you're having a flare, your flare is gone, and it's often minimized, and you don't get the opportunity to share the entire experience with the doctor, so they're not getting the full picture. They're not understanding how much pain you've been in for the last few months or weeks or days. They're not seeing the volumes of exudate, the drainage, the soaked dressings. So being able to actually document that in a way that your doctor can access, just kind of with a couple of clicks, but it's also very secure, is very unique.
Yes.
So I think that's a huge step forward in, first of all, the doctors being able to understand the actual experience of the patient and the patient having control over their condition.
Yeah, it's all about, really empowering patients to take back control over, what they're experiencing and, empowering them to be really a partner with the doctor rather than just kind of, being told what to do. And that partnership really helps to foster better outcomes long term because, it's really tough to when there isn't that dialogue and level of trust and like patient-physician rapport. But I think that by empowering the patients to be able to share their experiences for the 99% of time that they're not physically in the visit, that it really helps to foster that bond.
Yeah, I love that you're using the word empower because that is a very important word for me and HidraWear Solutions. We want to empower patients to self-manage and self-care with their wound care in the home setting so that they can have an improvement in quality of life. Because there is the therapeutic agents or the medicine that needs to be provided to patients and sometimes a surgery, but there's also the day-to-day management of the disease, which is a huge struggle when you have a lot of exudate, a lot of drainage, blood, pus, and not very effective solutions for keeping them in place, particularly in like the armpit, the buttocks, the groin. I truly believe that by empowering patients to control their wound management and the day-to-day management of hidradenitis, plus enabling them to interact with the physician in such an accessible way will have a huge benefit to patients. So what we found in the clinical trial that we did in Ireland was really dramatic improvements in quality of life, and that was using the Dermatology Life Quality Index. So for anyone who's seen a dermatologist, you will most likely have filled out this questionnaire. It's 10 questions and it asks you about different aspects of your life, and the maximum score on this questionnaire is 30. And if you have a score of 30, your disease is having a severe impact on your life. And if you have a score of 0, it's having no impact. So any score in between, it kind of indicates the impact of the disease on your life. With HidraWear and the clinical study we did, we had patients using the product for 21 days. And we could see that even after week 1, there was a dramatic improvement in quality of life. But the most, I suppose, exciting results and the ones that made me incredibly proud was the day 21 results, where the average or the mean score of about 19.8 was reduced, which means that it was having a bad impact, a huge impact on the patient's life, was reduced to below 5. And that means that it was having a low impact on patients' lives. So we found that patients were able to go to school or work a lot more, frequent social outings, their relationships improved, just every aspect of their life improved by being able to manage their HS exudate. So I'm incredibly passionate about this because I just think if you give people the tools to manage their disease, they will have really good outcomes.
And it makes a lot of sense, right? I mean, it's anecdotally from our patients that started using HidraWear, you can see, how much happier they are just by being able to manage their wound, not be afraid of having drainage, given that they want to be living their lives. They want to go to a party. We had a patient that had recently started college and was going to be away from home for the first time, and, giving her the tools so that she didn't have to be afraid of having, any drainage, etc., and to be able to wear, the clothes that she wants to wear and not having it be such a burden, needing to use these excessively bulky dressings that all too commonly make people not want to go to social outings as much.
Completely. And another huge finding was the reduction in pain. And that's specifically dressing related pain. So removing adhesive, kind of having to maneuver your arms up or down or twist and contort your body to get these dressings in place. The scores were reduced to next to nothing. And that was just by using the product HidraWear. which is completely adhesive free.
Yeah.
So you don't need to be sticking things onto yourself. You don't need to be wrapping yourself up in different bandages or stretching or using pins. It's just very easy to apply, adjust, and remove.
Yeah.
And the dressing-related pain reduction was really significant. And it means that, you know, when you're living with a chronic disease, it's difficult enough. But when you have the added pain, constant, frequent pain, it's just so exhausting.
Yeah.
And that is being removed or reduced, substantially reduced, using HidraWear.
Yeah.
So
when I first see patients, just from examining them, you know, you can see a lot of what they're currently using. And a lot of times, yeah, it looks extremely painful, just the process of getting off, you know, the bandage or like, you know, whatever type of current system they've usually developed over time themselves. But, you know, giving them a better option that is really designed for HS, I think that is such a game changer.
What's the process, first of all? Sorry.
Yes, no, absolutely. So patients, you know, come to Tono Health, they fill out an intake, and they are scheduled for an appointment with an HS specialist, usually within 3 days, but generally under a week. So we really want to emphasize, you know, just giving patients access to specialty care in a timely fashion.
Yeah.
And so once they're onboarded and have their appointment, you know, during the appointment, the physician will be evaluating them, evaluating their wounds, their drainage, etc., and coming up with a really comprehensive treatment plan that is going to be, you know, everything from topical treatments, medical management, and the wound care solution is such an integral aspect of that. And you know, then after that, then their, you know, prescriptions or treatment plan will be sent off, and you know, they receive everything, including their HidraWear.
At the moment, a lot of providers don't maybe provide wound care, so they would be focused on the medical treatment of HS, or referral to a surgeon, but not actually on the day-to-day kind of management of the exudate and the drainage. So you might get a referral to a wound care clinic, or you might, I suppose, be given some general advice about what to do, but no, not many are kind of taking the bull by the horn.
You know, not many providers are really addressing like the nuances of wound care, because, you know, it is a entirely innovative field with a lot of advances, and so, you know, finding someone that's knowledgeable in wound care and is able to, you know, provide guidance and recommendations is, you know, sometimes a bit of a challenge for people to get access to.
Yeah, and so I think the huge benefits to patients using the Tono Health platform is that they have access to expert medical care, referrals to surgeons or kind of diagnostics if they need them, and access to wound care all in one place.
Yes, absolutely. No, we want to make sure that, you know, we're giving patients a comprehensive plan that can really address all of, you know, the different elements of living with HS and of their experiences. And I think that, you know, wound care ends up being a pretty big part of something that they're likely going to be, you know, dealing with, if not every day, anytime they have flares. And so coming up with a game plan of how best to approach these situations so that they're not in pain and so that they're able to, you know, live their lives, go about their lives, go to work, go to their kids' soccer games. I think that is really, you know, where we're headed and where the future of HS stands is, you know, delivering that next level care and experience.
Yeah, it's fantastic. So I still hope you come to Ireland one day.
Yes, absolutely. No, we're excited to expand, you know, beyond we're currently in 15 states.
Mm-hmm.
We have 8 more coming in the next few months by the end of this year. And, the goal is really to increase access to all 50 states, and then hopefully one day going international.
Hey, do you have any specific examples of what it was like for a patient to get HidraWear through Tono Health on their insurance and what the benefits were?
Yeah, absolutely. So many of our patients have been able to get HidraWear through their insurance, and it has been, really rewarding to see how much it's improved their quality of life. So, for example, we have a patient who is a father with young children. He's driving them around to soccer games on the weekends. And before, it used to be really challenging for him to sit through the whole game. There was, always kind of this fear of the drainage aspects. And then with HidraWear, now he feels really confident and comfortable going to the games, sitting with all of the other parents, not needing to go to the restroom to check and make sure everything is okay all the time.
Yeah.
And just even in his day-to-day, going to work, sitting in an office desk, all of those things can be extremely painful. And going back to what you were saying about, the element of pain and the role that the dressings are playing in that, having wound care solution that is able to reduce that pain is so important for people to be able to function in their day-to-day and to continue to do all of their normal daily activities from work all the way to the soccer games.
Yeah, completely. And actually in the clinical trial there was 30% of the patients who were enrolled had previously required pain relief in advance of a dressing change. So they would kind of take some painkillers before they knew they were going to be taking off their bandages, and using HidraWear, no patients needed pain relief to do a dressing change.
That is incredible. I had no idea. No, that is huge, because I think, and you can see it when the patient is, showing you their wounds during an initial visit. There is a lot of pain associated with, the taking off, putting it back on. And, you being able to mitigate that pain, because, you're right, at follow-up visits when they're showing me areas, they're not in pain with the HidraWear product. So that's really incredible.
And I think what we're seeing coming out of the UK case studies is also improvements in the areas themselves. And so by wicking away all of that exudate, the skin isn't getting macerated, or kind of that moisture isn't sitting on the skin. So there's less irritation, less rashes, less kind of stinging. And also because there's no adhesive, there's no skin stripping or kind of adhesive skin injuries as well. So the surrounding skin is really improving, and the HS lesions themselves are improving just from being able to manage them properly. And, that's very exciting for us, We know that they don't heal, but they can improve, and the surrounding skin can improve.
Yes, and I think that, by setting up the optimal conditions for wound healing, it does promote healing. So by reducing the amount of exudate that's present, and, I think that the HidraWear technology of the bandages is really remarkable in that, it's not only able to absorb a lot, but it's also, protecting the skin. And so I think all of those aspects, working together really sets patients up for success.
And so I suppose we are going to be working together quite a bit, and very excited about it. And I think what sets the two of us apart is we are both incredibly passionate about our objectives. The main one is improving the lives of people with HS. And we want to reach patients, and we want to reach anyone who might be unsure whether they have a diagnosis, or unsure whether they have HS, or if they're struggling to find a provider that works for them, or even if they have a provider but need a bit of extra support. Is that safe to say?
Yeah, absolutely. I mean, I think it's, there's a lot of diversity in patients' experiences. And so giving people optionality is so critical. So, again, it goes back to empowering patients, right? That they don't need to be a bystander in their own care. They can take control and take initiative and, be an active participant. And we want to encourage that. We actually have a lot of patients, that still see an in-person dermatologist. And, it doesn't need to be an either-or-ish situation.
Yeah.
We actually usually work really well together. We work with many surgeons on providing the pre and post operative medical management. And, I think, it's a much more, multidisciplinary approach.
Yeah.